So, good morning, guys. Today, let's talk about the chapter 17 of your book, which primarily talks about health, wellness, and illness. So, somehow, some of the words here are self-explanatory, so I don't need you to discuss it or elaborate it more because somehow it's easy for you to understand. So, along the way, as we go along with our lecture this morning, we will be identifying the differences between the three concepts. So, a person who has terminal illness may have a sense of well being. So, in contrast to that, a person who is in a good state of health has lack of sense of well being. So, it really depends on the perception of the individual. Okay, so now let's talk about health. Health is defined in terms of the presence or the absence of disease, and there are definitions of health according to Nightingale and WHO. So, according to Nightingale, she defined health as a state of well being and using every power the individual possesses to the fullest extent. So, as far as you can remember, Nightingale formulated the environmental theory, which primarily focuses on the utilization of the environment to create an impactful health towards to the client. Okay? So now, the WHO naman define health is a state of complete physical, mental, and social well-being and not merely the absence of disease or infirmity. So guys, there are a lot of criticisms or a lot of critics have already responded to these definitions because according to them, this definition of WHO is unrealistic. Kasi guys, there are tendency in our lives that we are physically stable but some of our dimensions of health are not actually okay. So, somehow sabi nila it's actually unrealistic. Pero somehow, hindi naman get-change ni WHO ang kanyang definition. Now, let's discuss wellness and well-being. So, it includes self-responsibility, an ultimate goal, a dynamic growing process, daily decision-making in the areas of nutrition, stress management, physical fitness, preventive healthcare, and emotional health. Somehow, wellness, guys, to maintain a sense of well-being, you also have to do a portion of stress management. You have also to manage your health, your physical aspect, your emotional, and your mental aspect as well. Okay, to attain a sense of well-being, and you must deal the seven wellness factors, which are the following: environmental, social, emotional, physical, spiritual, intellectual, and occupational. So we have to discuss it briefly lang because it's self-explanatory already. When we say environmental, it talks about the standard of living or the quality of life we are experiencing right now. Okay? So we cannot deny the fact that those persons who are living in the poorest sectors of the community have also suffered from the quality their poor quality of life. They don't have enough resources when it comes to their food, to their water. Of course, that might also impact their health. When we say social, it's the ability to interact successfully to other people. Okay, so how we communicate with other people, the way we tolerate others' opinions and accept also their beliefs. Okay, we have to accept their beliefs and we don't need to restrict ourselves from accepting others' opinions. Okay, so when we say emotional, it's the ability to manage stress and express emotions appropriately. So there are a lot of medium on how to express your emotions. Um, there are a lot of cases already in this era, guys, wherein people cannot express their emotions appropriately, where in fact that might leads to suicide or other form of um self-harm, right? So now, for you to be considered and for you to attain a sense of well-being, you have the ability to cope stress and to express your emotions appropriately. So how can you express your emotions appropriately? Of course, by sharing it to your friends, by doing some sort of meditation, by doing some sort of recreational activities or any distraction activities. Okay? Physical naman is the ability to carry out daily a task, achieve fitness. When it's spiritual, it's the belief in some nature and it includes own values and ethics. Intellectual as well, the ability to use the information effectively. That involves striving for continued growth and learning to deal with new challenges. Occupational naman, the ability to achieve balance between work and leisure time. Well-being is a subjective perception. So this is what I mean, okay? Well-being is a subjective perception of vitality and a feeling of well can be described objectively. So it's a matter of perceiving your own status, okay? It's like a subjective perception of how you perceive your current situation right now. So please make sure that when making nursing care plan, it should reflect the client concepts of help rather than the nurse belief. Okay, so dili nato i-consider atong belief once we are doing our NCP. We have to consider the belief and the concept of health based on the client's perception. Okay? There are models of health and wellness. Okay? The first model is the what we call clinical model. So clinical model is considered as the narrowest interpretation of health. Why is that? Okay, bakit siya consider as the narrowest interpretation of health? Health kasi is defined by the absence of signs and symptoms of disease or injury. Okay? So, when the signs and symptoms are no longer present, the practitioner consider them as healthy. This is according to the clinical model. So, the practitioner cannot declare the person healthy when the signs and symptoms are still there. So, it should be properly or it should be evacuated or it should be properly vanished prior the practitioner could declare the person as a healthy individual, which is somehow a narrow interpretation. So another definition would be a role performance model, where in fact it defined health as the ability of an individual to fulfill societal roles, that is to perform his or her work. So people who can fulfill their roles are healthy even if they have clinical signs and symptoms, okay? Even if you're battling with illnesses, as long as you're able to do your own daily activities, you go to work every day, you still perform your activity efficiently and effectively, you are considered as a healthy person. Okay, that's what we call role performance model. Another one would be adaptive model. Can you still remember the adaptation theory of Roy? Okay, Sister Callista Roy formulated the adaptation model. So, disease is a failure in adaptation, or what we call as maladaptation. If you cannot cope with that specific stress, it may lead to disease. If you cannot overcome that particular problems that you are encountering right now, that might lead to an illness. Okay, so the focus of this model is stability. This is the third model. The fourth one, sorry, is eudaimonistic model. Okay, eudaimonistic model. It incorporates a comprehensive view of health. So actualization is the apex of the fully developed personality. So this one would be, can you still remember the Maslow's hierarchy of needs? In Maslow's hierarchy of needs, as you can see the pyramid, the apex located in the upper portion, diba? The apex in the apex portion is the actualization, right? So this is the model that is referring to the actualization process. So illness is this in this model is a condition that prevents self-actualization. So according to this model, you cannot achieve actualization if you are suffering from any illnesses or diseases. Another one would be agent host environmental model. It is also called as ecological model, which is originated in the community health work, used primarily in predicting illness rather than promoting illness. This model has three dynamic interactive elements. When you are being asked, somehow nagalabas po ni sa community when you're being asked what the three dynamic interactive elements in agent host environmental model. That would be agent, host, and the third one would be environment. Okay, agent is any environmental factor or stressor, like it may be biologic, chemical, mechanical, or physical, or psychosocial, that can lead to illnesses or disease. Okay, when you say biologic, it's somehow dealing with your own body. It's maybe hereditary or genetic factors. When you say physical or psychosocial, that may lead to illnesses or diseases. So any stressors that we are dealing every day, that might lead to illnesses or diseases. Busy host may or may not be at risk of acquiring a disease. It consists of family history, age, lifestyle that influences the host reaction. Of course, if you are immunosuppressed, when I say immunosuppressed, it means your immune system is down. So of course, the way you counteract with stressors iba na. So you cannot actually adapt well to the stressors in your environment. In contrast, if you are a healthy individual. So environment naman, it involves climate condition, sound, noise levels, and economic level as well. So other are loss of family, spouse, or closest friends that might also affect your emotional health or your mental health. Next would be health illness continua. Okay, let's discuss the health illness continua. So the first one would be Don's high level wellness grades. If you are going to look at your book, you can see the diagram. So high level wellness in favorable environment. So an example of this is an environment a person who implements healthy lifestyle behavior has the biopsychosocial, spiritual, sorry guys for my voice, and economic resources to support this lifestyle. So this type of individuals who have good lifestyle, at the same time they are also living in a good economic situation, like yayamanin, like they are can afford, right? They can afford the healthy lifestyles, and of course they're also living in a good environment. Next would be emergent high level wellness in unfavorable environment. Meaning, an example is a woman who has the knowledge to implement healthy lifestyle practices but does not implement adequate self-care practices because of other responsibilities. Although alam niya how to do that, how to maintain, how to practice healthy lifestyle, but due to inadequate economic resources, they cannot achieve um, sense of well-being, or they cannot achieve the healthy lifestyle. The third one would be protected poor health in favorable. An example of is if this is an ill person, one with multiple fractures. So this is poor health, whose needs are met by the healthcare system and who has access to appropriate medications, diet, and healthcare instruction. Although they are suffering from poor health situation because they have comorbidities, they have naman na favorable environment. So, meron silang access to healthcare. They have insurance, or they have enough resources. They have loved ones who supported their medications and other healthcare instruction. So the fourth one would be poor health in unfavorable environment, meaning a young child who is starving in a drought-stricken country. Or another example of this was a poor individual who is suffering from an illnesses and who is living in a poor sector of the community. So this is the fourth example. So there are variables influencing health status, beliefs, and practices. So the first one would be biologic dimension, meaning it's self-explanatory. It deals with genetic makeup and the developmental. So it also we have to tackle one by one. The first one would be sex. so influences the distribution of the disease, because there are some diseases, guys, that are most common in male, and there are also diseases that are common in female. So certain acquired disease are more common in one sex rather than other. So one of the best example of this are osteoporosis and rheumatoid arthritis are most common in females and very rare in males. Okay? So there are chances kasi, guys, na nagadepende po siya sa kung sa baka babae baka or lalaki. So in males naman, stomach ulcers and abdominal hernia are the most common. And very rare lang gini siya sa mga babae. The next one would be age, okay? The distributions of disease varies in age. For example, arteriosclerotic is common in middle-aged individual. Arteriosclerotic kasi sa condition wherein your arteries in your heart are being covered by mga fatty acids like fats. So, na-cover siya. It's because of your lifestyle, because of your diets. So, of course, if na-cover na siya fats ang imong heart, especially the muscle area, it cannot actually pump blood away and towards to your body. So, it cannot function effectively. That might lead to some problem. So, for this, middle-aged individuals will going to suffer this type of diseases. I'm not saying that, guys, that all middle-aged individuals, most of the middle-aged individuals are suffering from these diseases. Okay? Excuse me. Okay? Another one would be communicable diseases such as pertussis and, sorry for the spelling, it's single S, and measles are common in children. Okay? Let's talk about developmental level. So infants that lack of physical and psychological care have lower defenses in disease. Of course, kasi in contrast to those infants who have enough resources, enough foods, di ba? They have enough vitamins. They are being supplemented with vitamins and so forth. They have higher chances in defending themselves from diseases, unlike those um children who are suffering from shall we say economic factors problems. Okay, they are poor, they don't have enough access to food and water. So declining physical ability as well can limit the older adults to respond stressors. Remember that the more the person gets older, ang response nila ang immune systems gets magbaba din. So that might lead to dali sila makontaminate or ma-infect of illnesses and other diseases. Second one would be psychological dimension. So it talks about the emotional factor influencing health include mind-body interaction and self-concepts. Mind-body interactions can affect health status positively or negatively. Like for example, a student who is extremely anxious before a test may experience urinary frequency and diarrhea. Okay? So somehow it's like mind over matter. It's the way how you control your mind. So relaxation, meditation, and biofeedback are some common method to deal with some anxiety. This type of methods, we will be discussing this in the later chapters of this book. The third dimension will be cognitive. Okay? From the word cognitive, the lifestyle refers to a person's general way of living, including living conditions and individual patterns of behavior. Okay. There are also risk factors that we are going to consider that have potentially negative effects on health. For example, overeating without sufficient exercise can problems and hypertension. So there are also religious beliefs such as Jehovah's Witnesses oppose blood transfusion. So we have to respect that. So there are patients of us who are going to refuse blood transfusion. Of course, we have to accept and we have to respect their decisions, provided that they will going to sign refusal form para at least safe po ta as nurses. And there are also external variables. Kato akong gi-mention are internal variables. Now we have to talk about the external variables. And the first one would be environment, geographic location, that means the climate and the climates that affect health of the individual. Standards of living, it reflects the occupation, the income, your economic stability, and the environmental conditions that have a bearing on the overall health of an individual. The third one would be family and culture beliefs, okay? The physical or emotional abuse may cause a long-term health problems. A climate of open communication, sharing, and loving fosters the fulfillment of the person's optimal potential. So once you have enough support system, you have that open communication with your family, with your friends, with your loved ones, and you can actually attain your fullest optimal potential. Okay, next would be social support networks. Having a support network and job satisfaction help people avoid illness. So it also provide the motivation for an ill person to become well again. The next that we will going to discuss is the word healthcare adherence. Say adherence, guys, is sa Bisaya pa is kanang mutuman. Okay, adherence meaning pagtuman sa pasyente sa iyahang therapeutic regimen. Pagtuman sa pasyente, for example, na yung mga reseta, na ipanghatag na mga lifestyle modifications. Adherence talks about the way the patients will going to follow, the extent the patient will going to follow the instruction of the practitioner. Adherence is the extent to which an individual behavior or making lifestyle changes. So a degree of adherence may range from disregarding every aspect of the recommendation or following the total therapeutic plan. So as a healthcare professional, we really have to our encourage our patients or clients to follow the therapeutic regimen so that they will going to attain or they will going to experience a kumbaga a good state of health. When a nurse identify non-adherence, it is important to take the following steps. So, there are tendency, guys, na nadya mga clients nato na mga gahig ulo, dili maminaw. So, here are the following that we will going to, here are the following measures that we will going to establish. The first one would be, we have to assess why is that the client is not following the regimen. Maybe they are dealing with some problems, baka di lang niya makuha ang instructions or dili enough iyahang budget. So we have to explore every factors that we can actually assess why is that our client is not following the regimen. And the next one would be demonstrate caring. Maybe you are not empathetic enough. Maybe you're not a good nurse. Maybe you're not actually listening to the client's concern. So you have to demonstrate caring, okay, behavior towards your client. The third one would be encourage healthy behaviors through positive environment, okay? Use aids to reinforce teaching. Maybe your client is an elderly individual. He or she cannot hear you enough. Kailangan niya og somehow, kailangan niya og demonstration kasi hindi niya marinig masyado or kailangan niya ng lectures. You have to explore another ways or forms of teaching. And also, you have to establish a therapeutic relationship of freedom. You have to make the patient feel that they are not restricted at all. It has mutual understanding and a mutual responsibility with the client and the support system. And make sure you involve the family of the client. Okay, now let's discuss illness and disease. So, illness is a highly personal state in which the person's physical or emotional and intellectual, social, developmental, or spiritual functioning. So, an individual could have a disease and not feel ill. Okay? So, there is a difference between being ill and having the disease. You can have the disease. You are actually suffering, for example, a certain disease, but you don't feel ill. So napay panahon nga wala kay sakit but you feel ill. So that's the definition. Okay? Similarly, a person can feel ill and yet have no discernible disease. So it's just a matter of personal state of well-being. While in contrast, disease naman can be described as an alteration of the body function resulting in the reduction of capacities or shortening of the lifespan. And always remember that the causation of disease is called etiology. Example, an etiology of tuberculosis is a bacteria, okay, a bacteria that is called as Mycobacterium tuberculosis. It is an etiology of tuberculosis that penetrates the lungs of the person, which lead to tuberculosis. That's why guys, trivia lang, when you go abroad, especially in the western countries, we tend to be stereotype. Okay, Philippines, Pinoy nurses are tend to be stereotypes kasi most of the Pinoy are having tuberculosis. That is why pag mag-abroad kayo, very specific sila sa TB. Ginapa-extray talaga, ginapa protein protein purify derivatives pa gina-PPD pa ang mga Pinoy nurses prior deployment to be sure na walay TB. Okay? Now, there we have to differentiate acute illness and chronic illnesses. Kasi guys, pag magsabi na tayong acute, lala na kaayo, di ba? Pag sa bukid-bukid lang. That's why when I heard something about that, may acute na good kaayo ang iyang kanang condition sa pasyente or condition asa katong silingan, I tend to correct the misconception about acute illness. Okay, now let's discuss the difference between acute illness and the chronic illnesses so that you as well, student kayo, yung makorek po ninyo ang inyong mga friends, inyong classmates, inyong significant others, inyong mga neighbors, tira, about aning nga mga terms, okay? When we see acute illness, is characterized by symptoms of relatively short duration. Meaning, ubo, sipon, kalentura, that's acute illness. Symptoms appear abruptly and subside quickly, meaning apira siya kadali and then mahanaw po siya dayon. Some acute illness are serious. For example, appendicitis that requires surgical intervention. And tip ko lang kayo guys, pag you're suffering from appendicitis, your appendix is located at the kasi I know nag-anatomy naman kayo, di ba? Your appendix is located at the right lower portion of the right lower quadrant, right? Di ba there are 4 quadrants, di ba? Hati man na ganyan, the right upper, right lower, left upper, and left lower. So your appendix is located at the right lower quadrant of your abdominal region. Now, if you are suspecting na may nag-rupture ang appendix mo, or for example, your appendix is quietly inflamed or nag-swell siya, that is called appendicitis, do not ever take, kasi masakit naman yun, di ba? So, do not take pain medication. Do not take mefenamic, ibuprofen, or what. Kasi, di mo man good mamalayan, di ba sakit man siya, e nagiinuman mong tambal, and then, syempre, wala kayo ma-feel na pain. Kasi guys, the sign of peritonitis, which is a serious and fatal condition, it's a complication of appendicitis. Pag dili matambalan, that may lead to peritonitis. Now, dili ni mo na mabalaan if nag-inom ka og pain reliever. Kasi mabalaan na nimo nga nag-arrive na kaana nga serious condition if mag-stop ang pain. So if mag-stop ang pain, pasabot ana nag-rupture na imong appendix. That may lead to serious complication. So, di mo mabalaan ang nag-rupture na imong appendix kasi giinuman mo ng pain reliever. So, if you thought na nawala lang ang sakit, but the truth is nag-rupture na dito. So, that is why, if you have some problem in your right lower quadrant, do not ever take pain reliever. Kasi guys, di mo mabalaan if nag-rupture na. Kasi ang appendicitis sakit. So, pag mag-rupture na siya, mawala na ang pain ana. Okay? Some are mild, like colds, and we have subside without medical interventions. Following an acute illness, most people return to their normal level of illness. So you have to correct your neighbors about this. Sabihin mo, acute illness, madam, it occurs, the symptoms occur abruptly, but of course, it also subside quickly. That's acute illness. Now, let's proceed to chronic illness. One that lasts for an extended period of time, like cancer. If you are diagnosed with cancer, leukemia, ganyan, that's chronic illness. Usually 6 months or longer. You usually have slow onset and have periods of remission. Do not forget these terms, guys, ha? Remission, exacerbation. Do not ever forget that those. So, ayaw yun ninyo kalimti, okay? When we say remission, when the symptoms disappear. Okay, mo nang ginatawag na kasi chronic illness, may mga panahon na nawawala ang symptoms. That is what we call remission. And may mga panahon din na nag-exacerbate siya, meaning, ng symptoms nag-reappear balik. Example of this are, it's are arthritis, heart, lung diseases, and diabetes mellitus. That are diseases that are considered as chronic illness. So, pag na kay mga diabetes tira, it's not acute, it's chronic because usually 6 months or longer. If you have lung diseases, you are diagnosed with cancer or leukemia, it's chronic illnesses. So there are 5 stages of illnesses according to Suchman, 1979. So do not forget the stages of this, okay? This will also occur in your board examination, so don't forget this one. If you have time, you take down, you get your pen and paper and just write it down in your notebook. We will be discussing the 5 stages of illnesses according to Suchman. The first one would be symptoms, experiences, okay? For example, na-diagnose ka cancer, you have experienced initially symptoms. You have pain in some areas of your body. So, the person comes to believe that there is something wrong. Okay? Nafe-feel mo na nga sanay something wrong. But the person also looks unwell and experiences some symptoms such as pain, cough, rashes, and etc. And this stage has 3 aspects. Experience of symptoms. So, nafe-feel mo physically. The cognitive aspect, which is the interpretation of the symptoms in terms that have some meaning to the person. The emotional response, or the fear of anxiety. And at this stage, the person usually consult others. So, they don't actually consult automatically the healthcare practitioner. Usually, they consult their friends. Sis, na ba changes? Sis, na ba nagdako ba ni? Ganyan, ganyan. So, the sick person will try other remedies. Okay? They will going to try other alternative healing treatments. So, if self-management is ineffective, now the individual enters the next stage. For example, if they done some self management remedies, then they find out it's ineffective, then they will going to proceed to other stage of illness. Okay, that stage 2 would be assumption of the sick role, meaning individual now accepts the sick role confirmation from family and friends. So, sabi ng family na, yes, there's something wrong yun. Yes, dear, nagdako na gid ng imong kuan dira bukol, ganyan ganyan. So now, continue self-treatment. So they tend to continue self-treatment and delay consultation to a doctor. So this is the normal process. So emotional responses such as depression, anxiety are common. When symptoms or illness persist, they enter to the next stage, which is the medical care contact. So usually, they seek professional help, okay? Asking for 3 types of information: validation of illness, explanation of the symptoms in understandable terms, and reassurance that they will be all right, or prediction of the outcome. Kasi, if you feel that there's something wrong, prior contacting the healthcare practitioner, you have already established a prediction or an outcome. Sabi mo sa sarili mo na it is treatable, I could actually recover for 6 months. So may mga sariling prediction outcome ka na sa yung ginaisip mo na ganyan ganyan. But if the diagnosis by the client is accepted by the client, they usually follow the prescribed treatment plan. If nakaangay kay mo sa diagnosis sa doctor, usually they tend to follow. But of course, if the client they don't like the diagnosis of that said practitioner, they find to or the client may seek additional advice from other healthcare professional, and they will going to seek a diagnosis that fits the client's perceptions. The fourth stage would be dependent client role, meaning after accepting the illness, dependent on the professional for help. So they became dependent in terms with the medication, the therapeutic regimen. So they can be dependent, partially dependent, or fully independent depending on their ease and comfort. They can be dependent, fully dependent to the doctors, or they could actually maintain their independence as long as they could manage the comfort, or as long as they can manage their self. Okay? The stage 5 would be recovery or rehabilitation. For acute illness, time is generally short and recovery is usually rapid. And for those who have long-term illnesses or chronic illnesses, must adjust to their lifestyle, may find recovery more difficult. So for example, client who is suffering from diabetes mellitus type 1, kasi may dalawang diabetes kasi guys. The DM type 1 and the DM type 2. DM type 1 is a hereditary one. Okay, hereditary, it means nandyan na talaga siya with the moment you are born. DM type 2 is like a lifestyle. It's like just, for example, when you get pregnant, you have, this is what we call as gestational diabetes mellitus, where in fact, it could be treated by lifestyle modification. Pero pag si DM type 1 kasi mahirap siyang i-treat kasi it must be a lifelong treatment already. Okay? So that is why the recovery is difficult compared to acute illnesses. Final stage may require therapy to learn for major adjustments. So most of them or some of the clients, since they are having hard time to adjust to their normal lifestyle, therapy is actually a must. Kasi in therapy, they will be guided, they will be given so much information about their current health status. So don't forget those stages guys. Mao to atong stages sa stages of illness according to such man. Okay, the stage 1 would be symptoms experiences. The stage 2 would be assumption of the sick role. Stage 3 would be medical care contact. The stage 4 would be dependent client role. And the stage 5 would be recovery and or rehabilitations. Okay? So that would be all guys for this morning. And I hope that you have learned something for today. And I would like to apologize for my voice. Yes, the subawan, and I hope you're doing okay, guys. You have to take your vitamin C as much as possible. Drink a lot of water. Wear your face mask and your face shields once you go out. And do not accept strangers sa inyong balay because you don't know kung asa na sila gikan. At the same time, we have to offer prayers to India because they are really suffering from COVID outbreaks at this moment. So cases are surging and they have also lack of supplies when it comes to the oxygen and a lot of medical supplies. Their healthcare professionals are also struggling a lot. So let's offer a prayer to them and let's pray na somehow this COVID-19 will subside so that you will really learn a lot from face-to-face interaction. Kasi guys, iba talaga once you are in a classroom, in a classroom based form of teaching. Kasi you will be guided, you also learn to interact with your classmates. Kumbaga, enjoy siya unlike to this type of platform. Okay, so that would be all guys. I hope you're doing okay again, and this is Miss Ray again, and have a blessed day.